everyone, I'm Dawn. Welcome to my channel. Thank you for visiting with me today. So this is going to be kind of a serious video. I've talked about before when I was put in the behavioral health hospital for a week, and I've told you stories from it, but I didn't actually just get into just exposing them and saying how incredibly horrible it was, and I wasn't going to, but I had read some articles about the place and had read reviews, you know, people, how they do Yelp reviews and stuff. I read reviews, and most of what I read lined up with my experience there. And I think that part of the attitude with that place is who's going to listen to a bunch of crazy people, you know? And so I decided, you know, I don't have a very big platform, but, and you know, what are the chances of anyone who this is going to affect actually seeing this? But, you know, it's my channel, and I deserve to have my voice heard by whoever will listen. And I'm going to just share some detailed information about it, as well as read these articles. And first, I'm going to talk about my experience there first, and then we'll get into the articles. I have 2 articles, and they're not very long. So this is my truth about Riverpoint Behavioral Health in Jacksonville, Florida. And I am not shy or worried about revealing where it was. There was a time I wouldn't say where it was, but you know, now I'm going to. It's Riverpoint Behavioral Health in Jacksonville, Florida. And the first thing I want to say is, so I was brought in there on a Friday afternoon, and it took forever for them to get me admitted. But they were going to admit me because they said I was a danger to myself and needed to be admitted. And it took 2 hours. I sat in the lobby waiting for someone to acknowledge my existence, and so I was admitted, and they took my purse, my phone, everything from me. And I was fine at this point. And see, what had happened was I was severely anemic, and I passed out in public, and that led people to believe I was going to hurt myself. That's basically, in a nutshell, what happened. And so, and I was having some serious depression. I was in a serious depressed state and everything, but this isn't the place to go if you need to be helped with a problem like that. But what initially started it was me being anemic and passing out. But I'm not gonna sugarcoat it. I was very depressed. And I went in, finally, they checked me in, and it's just, that whole process took forever, but that's just bureaucratic red tape, and that shit just takes forever. Anyway, but, so I didn't get to see a psychiatrist until Saturday morning, and he went over my record because they talked to me the night before and did a questionnaire and everything. And he literally said, he actually said these words to me, that, you know, being molested as a child doesn't always have to be a bad thing. And those are the words he said to me. I promise you, I am not making that up. He literally said those words to me. Those words, he actually said those words to me. And I don't think I'm alone in this, but I think that's effed up, you know? And yeah, so that's, he was the first psychiatrist I saw. The second psychiatrist I saw seemed a little more normal thinking, but yeah, I don't know what he meant by that, and I don't know why he would say something like that to a patient who was, and I was triggered. I was having, there was just a lot going on, and it was just, I'm like, wait, are you trying to tell me that it's good that that happened to me as a child? Okay. All right, so I guess this is over. But he saw at this point that I was fine, and he said, I see you were Baker acted, and that's what they do in Florida if they think you're gonna hurt yourself or somebody else. You were Baker acted. And he said, we're gonna forget the Baker Act. I'm gonna take you off of that, and you're gonna be voluntary. And I'm like, oh, okay. So if I'm voluntary, I can check myself out. We're gonna get to that too. So after the meeting with him, I went out to the nurse's station and I said, okay, well, he said I'm voluntary now, so I wanna leave. And they were like, okay, well, just to let you know, that does take a few days because it has to be approved by the psychiatrist. I'm like, no, I'm voluntary. I shouldn't have to have the approval of anybody. I want to leave now. They're like, well, no, you can't. So basically they were holding me prisoner. They were holding me prisoner behind locked doors. All the windows are covered up so you can't see the outside world. It was just dismal. It was dismal. What you've seen in movies like One Flew Over the Cuckoo's Nest, I know a lot of times movies have plot devices to make things more interesting. It's what it's like. They're not lying to you about that part in movies. Okay, and the staff, I have notes because you know my mind. The staff, including nurses, fought with each other loudly, screaming and yelling and slamming doors, and did not care that the patients could hear and witness this. I saw shoving. I heard lots of yelling, cussing, name calling, and that was the staff, the nurses. Yeah. And that can't be good for someone's mental health, you know? I mean, a lot of these people are in the situations they're in adulthood because of witnessing that type of stuff when they were kids. At one point I needed my inhaler. Of course, they took my inhaler away from me. And I went up and I asked for it. I said, I knew an asthma attack was coming. And, you know, I could feel it rising up. It's hard to explain. It's like heat rising. I know if you have asthma, you might know what I'm talking about. My asthma is aggravated by anxiety or stressful situations. And I went up there and they said, okay, you're gonna have to wait a minute. When I said I said, I need my inhaler. And I was nice about it. I said, I need my inhaler, please. And they were like, okay, you're gonna have to wait a minute. And then I went, no, I need my inhaler now. I need my inhaler. If you would have just let me keep my inhaler, we wouldn't be doing this right now. You wouldn't have to be bothered by me. And I waited 30, 40 minutes for an inhaler. By the time I got it, I thought I was gonna have to go to the emergency room. And I don't know why. I don't know why I didn't do more back then. This was September 2021. I don't know why I didn't do more about it after I got out of that place, and I should have. And I think I just wanted to forget it. They traumatized me, and I had PTSD, and now I have it from that place too. I literally thought I was gonna die after not having my inhaler, and other patients are like, she needs her inhaler, she needs her inhaler. So yeah, that was fun. And non-apologetic and everything. You're assholes. Okay, and then when I already talked about that part, about, you know, being voluntary and telling them I wanted to leave. And the patients, we talked with each other a lot. So we knew our situations. We knew who had insurance and who didn't. And the people who were there with no insurance, they were gone within 12 to 24 hours after getting there. But the people with insurance turned out being there, and there were some people that I still talk to who were like, oh yeah, my insurance will pay for 7 consecutive days. My insurance will pay for 10 consecutive days. Mine would pay for 5 consecutive days. and we were all there the amount of time that our insurance would pay for. So there was one lady, this poor soul, her insurance would pay for 14 days, and they kept her the full 14 days. And I was there the day she came in, and it's like, this woman doesn't need to be here. And I mean, I'm no psychiatrist, but I don't understand why she was there. You know, she seemed a little anxious, but I don't know. I gotta put my glasses on because I didn't write my notes big enough. But yeah, and the insured patients or the uninsured patients who, just in my uneducated opinion, think they could have really benefited from some good psychiatric care. They weren't going to get it there, but yeah, they were gone within 12 to 24 hours after getting there. Oh, when I first got there, I expressed my concerns about, because there were some scary men there. And I know, you know, you can't judge a book by its cover. Anyone can be scary, but I expressed my concerns to the intake nurse about, you know, I'm like, well, everybody's just kind of walking around. I'm concerned about these male patients walking into my room. You know what I mean? And they were like, oh, they were assuring me that, oh, no, 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 the halls are heavily monitored. You won't have any problems with that. And 4 different men in that hospital walked in my room while I was in it, 2 of them while I was laying down. And no one stopped them. I yelled at them, and the first one came in, and he was going, and I could tell, I know what was going on. I'm not naive. He was going to hook up with the young girl in the room with me. And he walked in, he goes, no, baby, it's okay. And then he said something like, oh, Dawn's cool. And I went, no, I'm not. I'm cool out there. In here, you don't belong in here. Get out. And one guy just walked right in my room, like, he looked like he was gonna start shuffling through our belongings. It was me and 2 other girls in there. And I guess he didn't realize I was there. And I said something to him. I'm like, this isn't your room. And he, oh, I'm sorry, I got confused. He didn't get confused. He didn't. The group therapy was unorganized, unplanned. It was like they were making it up as they went along, and it was all the same thing. All the group therapy was the same thing, and it was ran by, I don't know who. Like, they weren't therapists. I don't understand that part. They weren't ran by mental health professionals or anybody even certified in that field. Oh, and at one point, you know, at night, for evening medication, they give you drugs to help you sleep. So they drug us and send us to bed. And I'm happy to take the drugs because as long as I'm asleep, time is passing by while I'm sleeping. And they came in to our room in the middle of the night, me and this other girl. The other girl had gone home, so it was just me and this other girl. They came in there in the middle of the night, woke us up, told us we had to get all our things, unmake our bed, and we were being moved to another room because a male patient has been admitted and there's no place for him. And this was the middle of the night, like 3 o'clock in the morning. And I was just like, you drug us. Then you make us get up in the middle of the night, gather all of our belongings, unmake our bed, go to another room to make our bed. And just, they need to have something else for a situation like that. They need to have a little room for people who come in late at night who they don't have a place for. They need to do that. They can't just go in there and wake drugged patients up. That was just disgusting to me. Eric, my husband, was trying to reach me. He could not get a hold of me. he'd left messages, because you're supposed to call and give them a code and then they transfer you. And he did that. He would give them a message and they would not give me a message. He left several messages. Nobody told me anything until I finally got to talk to him on the one phone. They had one phone in the hallway we could use, and there was this one woman that was on it constantly, and she would hang up. I would grab it so I can call him, and it hardly worked. It looked like someone tried to rip the phone out the wall, and I had heard other patients complain about that, and they were like, well, it's the only phone we have for you. And it was just disgusting. But yeah, and I know that he had gone up there and he complained. He said, well, she said she's here voluntarily. I don't think y'all understand what that means. And then also the doctor, the psychiatrist, the first one I spoke to, signed a paper allowing me to get my cell phone so I can get a phone number out of it so I can reach people in my family to let them know where I'm at and what's going on so they wouldn't be freaking out. And so he signed that on Saturday morning. I didn't get my phone till Tuesday afternoon, and that was after I lost my temper with them because I kept asking for it and asking for it. And their big thing was, you have to wait. And then I finally went off of that. I said, I have been asking for that phone since he signed the form to allow me to have it on Saturday. It's now Tuesday, and I haven't been able to notify my family, and because I need a phone number that's in my phone. And this bitch that works behind the counter went, well, you haven't talked to me. And I went, I'm talking to you now, because I was sick of it. Sick of it. But other than the psychiatrist fixing my medications, there's really nothing to be gained from this experience at all. Nothing. And I suspected from the beginning that all they did was warehouse people and bill the insurance company. And then when they could get away with getting what they can out of the insurance company, then you can go. But the whole thing was bullshit. They gave us prison food, which, I mean, I don't care about the food. Hospital food sucks anyway. Institutional food is not that great. But it was just such a prison-like atmosphere. Not that I've ever been to prison, but I can imagine. So let me read this article to you. But I want to read this one complaint to you first that I looked up online. Riverpoint Behavioral Health has a history of abusing patients' rights and keeping them for longer than necessary to collect insurance. And that is absolutely true. And this is in keeping with most of the reviews I read about this place. Here is a quote from a news article about this place. The whistleblower he represented alleged the Jacksonville hospital held patients improperly to exhaust their insurance benefits, admitted patients based on their insurance, billed for unnecessary services, and had group therapy sessions run by interns, unlicensed staff, and even former patients. All that's absolutely true. As someone who was held captive there for a week, I can confirm that the group therapy sessions were run by people with little to no experience in that role. They paid $122 million to settle whistleblower lawsuits. Imagine how much money this fraud operation is making to simply be able to pay out like that and then keep defrauding people like nothing happened. This place operates under the guise of offering help to others while actually doing the opposite and abusing patients' rights to collect insurance payments. This is a truly evil place, and everyone that works here will burn in hell. I'm sorry, that's not funny, but true though. Okay, so here's the first article I'm going to read. Behavior Center with Jacksonville Facilities reaches $127 million settlement with feds. A national behavioral health provider accused of keeping patients against their will has reached a settlement with the U.S. Department of Justice. Universal Health Services, which owns the mental health facilities Wekiva Springs and Riverpoint Behavioral Health in Jacksonville, agreed to pay the federal government $127 million to settle the investigation into billing practices. They need more of an investigation than billing practices. They need to investigate everything. Their mental health program is non-existent for a behavioral health facility. Action News has been investigating patient care at Wekiva Springs and Riverpoint behavioral health since 2016. Dozens of former patients have come forward claiming they were held longer than medically necessary so the facilities could milk their insurance payments. Army veteran James Shoup said he was involuntarily committed to Wekiva Springs in April under Florida's Baker Act. They just kept me there, Shoup said. Shoup said he saw the psychiatrist the day he was committed to the facility on April 6th, which was a Saturday. I told her what happened, and she's like, okay, I'm going to take the Baker Act off of you, Shoup said. He said he thought he was going to be able to leave that same day, but he wasn't released until Tuesday. I feel like I just got warehoused for profit, being that the VA didn't have a space for me, Shoup said. Shoup said he left the facility feeling traumatized. Me too. Me too. I at a point now to where if I ever feel like I need help, I'm going to keep everything bottled up. This is why people keep things bottled up, because it's not going to help them to open up about it. In its quarterly report, Universal Health Services said it's been advised that previously disclosed investigations being conducted by the DOJ's criminal fraud section in connection with these matters have been closed. Well, it needs to be opened back the hell up. And here is another one. Jacksonville mental health facilities dodge questions about fraud allegations. A dozen former patients and employees at Jacksonville mental health facilities have reached out to Action News Jax wanting to share their stories since an investigation we aired Wednesday. They want to talk about the accusations in a year-long BuzzFeed News investigation that psych hospitals owned by Universal Health Services hold patients against their will longer than medically necessary to milk their insurance payments. The company owns 2 Jacksonville locations, Riverpoint Behavioral Health and Wekiva Springs Center. Those facilities continue to dodge questions from Action News Jax about the allegations. One former patient told Action News Jax she went to Wekiva Springs Center voluntarily in October, looking for relief from her depression. She said they Baker Acted her and didn't give her any counseling. There's none, no counseling at all. We sat around all day doing absolutely nothing, she said. She said the facility charged thousands to her insurance and held her past the 72 hours allowed by the Baker Act, but she's no better off than when she walked in. I can say I'm actually worse. It was very traumatic, she said. In the meantime, Jerry Lynn Childress, who has attempted 21 times, said she couldn't get help. Childress doesn't have insurance. She said when her husband took her to the hospital in October with that kind of thoughts, not a single mental health facility in town would take her. I don't think that it's fair that people don't need it are there, and people that honestly need it and need the help, they're not. And they're not taking them because of money, said Childress. In the BuzzFeed News investigation, former employees of Universal Health Services said they were pressured by management not to accept patients who didn't have insurance. Wednesday and Thursday, Action News Jax reporter Jenna Bourne tried to get answers from UHS's Jacksonville facilities. Wekiva Springs Center Business Development Director Stella Breiskin asked Bourne to leave the property on Thursday, and Breiskin later emailed the following statement. Wekiva Springs has been a proud member of the Jacksonville community for the last 12 years. Our commitment to the community, clinical excellence, and patient-centered care has been the cornerstone of our success. As a Baker Act receiving facility, Wekiva Springs is in compliance with the applicable state statutes regarding admission and discharge. Wekiva has a long history of providing individualized patient care in a safe setting, treating individuals with complex mental health needs. All decisions related to admission, treatment, and discharge of individuals at Wekiva are made by the clinical treatment team led by the physicians. Breiskin declined to answer any of Bourne's questions about the allegations. Yeah, they won't answer the questions because they don't have any answers unless they're really shitty. But yeah, I'm sorry, I know this video ran on a long time, but I just felt it was important for me to reveal my experience there, and It did nothing. It made my PTSD worse. It was a terrible situation, and I've just now decided that I want to talk about it. I want to organize my thoughts, and so that's it, guys. It was, that field of medicine needs more respect. We need to do better, because mental illness is a very real thing, and it can cause all kinds of physical illnesses too, and physical illness can cause mental illness. It's all connected. It's our brain, man. It's part of our body. It's physical, and we need to take it more seriously and stop using the derogatory terms about people who are in these situations. When we see someone acting like this on the streets and stuff, instead of making jokes and thinking they're funny, be concerned. Be concerned about people. Love each other more, because facilities like this, they just want that dime. They're not going to try to help anybody. That place isn't there to help anybody. It didn't help me, other than, I will say, they did get my medication squared away. But other than that, I need the medications because of what that place did to me, what I had to see, what I had to hear. The hostility and screaming and yelling. I mean, a lot of us were there because of that kind of behavior. And then to have untrained, inexperienced, clueless people run unplanned, unorganized groups, it was just, the place is a joke. And the next time I'm feeling that depressed, I'm keeping it to myself. And just make sure I never have anemia again and pass out in public, because it turns into a shit show. But I regressed in how far I came in my mental health, and seeking therapy and everything. And I don't believe that the mental health system is there to help us. I don't know what they think they're doing, but it's not helpful. So that's it. Thank you so much for watching, and I hope you enjoyed this. I hope you took something away from this. If you're interested in researching, it was Riverpoint Behavioral Health. Riverpoint is 2 words, in Jacksonville, Florida. And I'm sure it mirrors a lot of mental health facilities, but that's the one I have experience with, and it was terrible and horrible. It's scary to be separated from your loved ones like that and not being able to reach them. And they need to respect people more, and don't hold people who didn't break any laws prison. You know, hold them in prison. So anyway, that's it. Thanks so much for watching, and I'll talk to everyone later. Bye.